We're recording now, so yeah, this is strange times that we're meeting and passing over the gavel from Nathan to Bill Eklund. So Nathan, I don't know if you want to go over that and then start the meeting. I know everybody's busy.
Well, welcome everyone to our COVID-19 and our Community Chamber, Orillia and District Chamber of Commerce Community Update. We've been fortunate so far that we'd avoided COVID in most of our communities, but it seems to be here and prevalent in Orillia and the surrounding area. Thank you for taking the time out to join us this morning. And I'd like to welcome our new Orillia and District Chamber of Commerce President, Mr. Bill Eklund.
Thank you, Nathan.
We didn't get a chance to have a formal passing of the gavel, and I didn't get my giant crystal handoff. But we'll get to that at some point this year. And look forward to stepping back this year. But Alan has asked me to step in and fill in and host these COVID in our community updates, so I'm not done yet. I want to thank all of our municipal leaders and elected members of Parliament for joining us this morning. And where is our hospital CEO, Mr. Carmen Stumpo? I'm going to jump right in and lead off with you first, as you've got our community update.
Thanks, Nathan, and I'll apologize in advance. I will need to jump off at 9:30. If it's any indication, 5 meetings booked by 9 a.m. on a Friday just is wrong on every front, but that seems to be the current state of affairs. To give an update, I'm going to start first at a larger, bigger picture provincial level. This week, very busy week with information and announcements. The modeling data came out this weekend. Lots of data, lots of numbers, and hard to interpret modeling going out very far. However, a few of the key messages that I want to share with you, because they are impacting the way we're approaching this. They're looking at possibly over 1,000 ICU cases by mid-February. That is astronomical. We're at 400 ICU cases so far in the province right now. Getting to 1,000 will cripple the system. It will mean choices that nobody wants to make. Death rates will double. So we are in a very significant, critical period of this pandemic. And it has, from a hospital standpoint, has taken over all of our work. There is nothing else we do in the hospital other than manage emergencies and deal with pandemic. And that is true essentially across the province. We recognize, and we'll let others speak to the stay-at-home orders, and I can't stress enough, if you even have to think about what is essential, then it probably isn't essential. That's the simplest way I can put it. It is absolutely critical right now that we follow through on that. A bit of an update on vaccines, and then I'll focus in more specifically with the hospital. The vaccine is the answer, and I know there's a lot of debate about who and when and timing. We need to get to everyone as quickly as possible. We've made a commitment to support the vaccination process through the leadership of our public health unit. We have been vaccinating in the hospital. We have been reaching out to long-term care facilities. So tomorrow I can tell you we have our primary care team is going out to Trillium. They're the last long-term care facility in Orillia that will be vaccinated this week, and we'll have covered off all the long-term care facilities. Next week, it's the retirement homes. By the end of next week, the retirement homes will be done. That will be one of the largest populations at highest risk that in 11 to 12 days, we'll start having antibodies, which will protect them from COVID-19, which is great news. So those are the 3 bigger picture items, and I'll start there. As a hospital, just to give you a sense of what we're working on, our local surge, we have 20 extra beds open, so I appreciate and really thank the province for coming through on that. Everything is full. We've reopened what we call our flex unit that is purpose-built that helps support COVID-positive patients. We have 2 patients currently. We're up to 5. Originally, those 5 came from our community, various forms, and now we're down to 2, but we need to be ready for more. We know we're going to get more. We've started to scale back our ORs to accommodate that. We see outbreaks in a variety of facilities in long-term care, at Trillium, at Georgian Manor. We see it in some of our congregate settings. And that is of concern because that can quickly, so far we're trying to keep it at bay. We're supporting all those outbreaks, but it can turn pretty quickly. We need to be prepared for that. We also started last week with transfers from the GTA, and I want to speak to that right now. It's a pretty dire situation. We're seeing cases here, but it's nothing like what's happening in the GTA. Hospitals there have over 100 COVID positive patients on top of everyone else they're trying to treat. And I think one of the saddest things that I've seen this week, there was a death this week of a staff member at Osler. And that was an environmental services worker that was announced yesterday. And it's unfortunate, it's sad, and I don't know the circumstances of the death, but it was COVID related. And they're not going to have a chance to grieve. They're going to keep working. They are full. They are seeing emergency patients 40 an hour. That's not going to stop for them. So they're going to keep going. And that's why we need to help. We need to help our colleagues in Toronto. So we accepted 3 patients last week from the GTA, from 2 different hospitals. I'll leave it at that. And I fully anticipate we'll be accepting more. It's not really a choice. We are told to accept it. This is an emergency management structure. However, it's a good process. They do take into account your capacity and they balance the need to serve your community with the need to serve the greater good. So our teams are up for that. It's an added element to this challenge that we are working on 2 fronts, local front and a provincial front, to try to help support the system. And the next number of weeks will be incredibly telling for us. I believe the system will be overwhelmed. It's very close to that right now. And we're making those necessary steps to respond to that. So I tell that to the community. And I said this in an interview recently, it's human nature to want to believe that it's not as bad here as it really is. And that's just, it's everywhere, it's human. And we have to avoid that. We try to avoid that in the hospital as much as we can. Our goal in the hospital, we come up with a plan and then we take it one step further. We overreact. That's our goal, is to overreact so that we can try to stay a step ahead, which with this virus, it's been incredibly difficult. So I would ask the community the same thing. Whatever you think is reasonable, take it one step further. I know it's hard, and I know for businesses it's brutal, but we are at a state that I know, talking to our emerge staff yesterday, they're true soldiers. They are in it, but they also recognize that the people that they are seeing in the emerge day in, day out don't fully appreciate the current circumstances and what we're heading into. And we need a full community response to that. So that's my plea today. I'm sorry, Bill, Alan, I'm never the bearer of good news, but I made a commitment to be as open and transparent as possible, and this is our reality. So I'm gonna pause there for questions. I'm sure there'll be a few. Judith?
I gotta unmute.
No, that's good.
Okay. When you talked about the antibodies will protect the people from the first shot. So once they get that first shot, their antibodies will protect them. So they would not contract COVID and have no symptoms to pass on to someone?
This is it's a great question. So let me explain a little further. So the data shows that currently the Pfizer vaccine, it's 2 doses, 21 days apart. You get your first dose. If you actually look at the data, by about day 10, 11, you already see an effect. People are protected after the first dose, after about 11 days. That's exciting news because we're going to have staff members. We've vaccinated 60% of our staff, almost with a high priority, the frontline staff, and they're going to be protected after 10, 11 days. And we believe that protection, that's where it starts working, if you will. That means we still need to offer the second dose. The science is suggesting we can actually delay that a little bit. The Simcoe Muskoka District Health delayed it to 28 days because we know that booster, the evidence is evolving. We're learning more as we go. And the key element here is to get as many people onto that first dose as possible, because we know after 10, 11 days, it confers some immunity. Right now, the data suggests one dose is gives you about 85% protection, and then the second dose jumps you to 95. That's current thinking, and I'm sure that'll change, but that's what I know. Dr. Gardner is having that dialogue as we speak with their experts around how to evolve the vaccination strategy. But that's the good news, and getting to the high priority areas with that first dose is priority.
Thank you.
Any other questions?
I have one more. I have another one. The mayor couldn't be here today. He has an affordable housing meeting, but he was on a webinar or a phone call yesterday with, and Jill, you could pop in too, with the Premier and Hillier. And Rick Hillier said, when a question was asked from the municipality, that we all have to do our part to help vaccinate the masses. So the mayor's question was, where do the municipalities fall into this, and how do we help, and are we getting organized so that when March comes and the most vaccine is supposedly coming, that we'll be ready to roll? And the other part of the question is, will you keep the municipalities and us informed, because we get so many questions?
Okay, great question on the vaccine rollout. So this vaccine rollout is evolving as we speak. So I can't even give you a sense, but I'll tell you how we're organized. So Dr. Gardner in Public Health has arranged a steering committee that involves a variety of different sectors. And we know that there is a wealth of providers out there. The challenge is the vaccine, both the availability and the handling. This vaccine, the Pfizer vaccine, is difficult. It needs to be frozen, and once you thaw it, it's only good for a few days. So it needs to be handled with absolute care. So that is the rate limiting step. Once we get into more vaccines, I think it'll change, and we'll be able to open it wide open. How does the municipalities? Well, the first thing we'll do, our Ontario Health team locally will take the lead in getting organized. So Judith, you're part of that, as is Ted Eamon, and that's how we will rally the local providers to ensure that we're getting to everyone we need to get to and moving that forward. And what we've seen work in the past, when we did the influenza campaign, we saw that between primary care and pharmacies, we can inject people faster than you can get them the drug. So we're going to try to use the same principles as much as we can and really roll this out. That is going to be our goal. That is the end to this pandemic, is the vaccine, and that's what we're going to do.
Thank you so much. Good, thanks.
I have a follow-up question to the vaccine.
Sure.
Yeah, it said that how well it works, et cetera. It stops the person from getting it, but does it stop them from transmitting it?
Another great question. I'll explain the term of efficacy, and I saw a great explanation of this by an expert on Twitter. So I'll try to paraphrase. So vaccines work several different ways. Vaccines can prevent you from actually getting the infection. If you don't get the infection, you can't transmit it. Vaccines also work by preventing the rapid growth of the infection in your body. So you don't get severe disease, or you don't get any disease. You may still get infected, but you don't feel the consequences. In that circumstance, it's unclear whether you can transmit it. And sometimes the vaccine works, you still get the disease, but you avoid serious complications. And that also happens, so you get milder disease. We have yet to see with wide scale use what the story is with this vaccine. It seems to be very effective. So my belief is it will reduce the transmission, and that's how you gain herd immunity, is when enough people in the community don't get the disease and don't transmit the disease, that it gets stopped dead in its tracks. So the jury is still out. The guidance is we don't stop any of our precautions until everyone is vaccinated. We all cross the finish line together, and that is why, because we don't know, and it's not 100% effective. So we want to keep people safe. This is an added layer. This is a peace of mind, but it's not a replacement for all the very, very difficult things we've been doing for the last 10 months or so.
That's a clear distinction.
I have a
We need to
question.
keep doing it until they get it, right? Until they get the vaccine, people need to keep those precautions in place all
We're
the way
trying to-
through, because until they know that the transmission is stopped as well, it's hard to say.
So I
Thank you.
believe this is my personal opinion. I believe this vaccine will be effective in slowing down the transmission. That's my belief. We don't have the evidence yet, but it doesn't matter that the restrictions, the everything. Now, let me rephrase. The restrictions may change as the burden of disease changes, as the amount of circulating virus changes. That's the whole goal, as you see in waves. And I can't predict that, but the concept of precaution, the concept of protecting the vulnerable has to stay in place until everyone's vaccinated. Sorry, there was another question, Matthew?
It's me. As a large employer, the plan is to roll out through the hospital and pharmacies. But as a large employer, is there some way that we can target our own employees and have distribution of the vaccine within the company so that we can keep working, or do we have to rely on encouraging our employees to go to pharmacies to get the vaccine when the rollout happens?
So there's a lot of consideration around mobile teams. And right now that's still very preliminary. So we don't have a sense yet. The mobile teams currently are being deployed into long-term care facilities. That's clearly our residents in long-term care can't go anywhere, so we need to go to them. So I wouldn't exclude any possibility, but right now I would say we will look at making this as low barrier as possible, getting access. I can't commit to whether or not it'll be extended to actual facilities. There is, as I mentioned, the logistics behind it that make it a bit more difficult. And especially when the vaccine is scarce, you want to keep it in one place because you'll have your supply and inventory spread across the entire province. And that makes it really difficult to get vaccine to people. So lots of considerations. I don't have a straightforward answer, but I would say as an employer, large employer, non-healthcare, I would prepare to get your staff to a vaccination center as quickly and as efficiently as possible. I think that would be wise.
Oh, we've got a break. No more questions, it looks like, from the floor. Carmen, when we started this, oh,
Sorry,
someone's got their hand up. Frank, go ahead.
Carmen, just two things. First, a statement. You're doing an absolutely magnificent job. Very, very impressed with how you've managed yourself and your extended team, right? So just please know that. I'm sure you already do, but you've heard it again from me. The second part is sort of tied to that. I get asked all the time by my staff and faculty members what, if anything, we can do to assist you and your team during this time. I know that as you've already indicated, your folks are working full tilt. They've got all kinds of stuff going on. Is there anything off the top that you think we can or might be able to do to help you out or them?
So first, thank you, Frank, and I'll pass it along the team. There's an incredibly dedicated group of people here that work on a drop of a dime throughout the holidays and beyond. So I'll extend that thanks to them. Passing this message along is probably the single most important thing. Having a consistent community response. I see such value in this group because of that. So that message gets harder 10, 11 months out. So that would be my first request. And the other, which when I look to Lakehead in specific, I know I'm picking up my steak this weekend to as takeout to do the learning to cook a steak properly sessions. We need to remember that mental health right now is a huge, huge issue. And we're seeing it. We're seeing people crumble, quite honestly. We're seeing patients, as described to me by a family doctor, our patients are falling apart because of all the disconnectedness. So whatever within the limited ability people have within these, especially within these 4 weeks of lockdown, but anything that we can do virtually to keep spirits up, to encourage the allowable outdoor exercise allowances, which I feel are incredibly important. Those are the things that are going to get us through what I think are going to be 2 of the toughest months this community will see. So that is what I would ask back at sort of at first thought.
Perfect. Frank, I know why we get along. You asked my question for me. Thank you. Carmen, thanks for your time. We'll continue to do whatever we can to support the city. We started with PPE demand at the start of this and then working on mask adoption. Judith, do you have your hand up with one more question?
Yeah, just one more thing. I just wanted to talk to Carmen. Sorry. It's what he said. That's why in Severn we're having a snowman challenge for January to get people out, and it's for seniors too, like cookies, cakes, or anything. And then we're going to have another one in February and in March, because I know that February and March and January are hard months anyway.
Yeah, please be creative, please be safe, and like I said, it's tough with the guidance, but it's so necessary with the restrictions.
Thank you, Carmen. I know you've got to run. Appreciate your time and appreciate you contributing to these meetings. Let us know if there's anything that the chamber and its new president can do to help you out. Thank you. We'll move on to provincial member of parliament, Jill Dunlop. And Jill, Carmen used a word there right at the end that I think is forefront in our minds in Ontario: disconnectedness, in terms of what we are and aren't allowed to do in Ontario.
I guess that's why I'm here today. And Carmen, you said about being the bearer of bad news. I feel like I have been all along, but at least we bring some good information along to work with everyone and hopefully to clear that up as well. So I appreciate that Carmen went first, because you can talk about the data and why that is leading to the things that we've had to do and put in place. So I too have to get off the call fairly quickly. I have cabinet and caucus right after, followed by 4 hours of meeting with my colleagues from across Canada today in the same ministry. So I thought I'd touch on the stay-at-home order, some of those public health measures, and a little bit about the vaccine from the provincial point. And I also in the chat room put the link for the Ontario website for the different grants and loans that are available for businesses, because they do range. They've been coming out all along, but that's kind of a one-stop shop for all of those business supports. And I really encourage businesses to look at those, because there hasn't been a very high uptake on the money that's available. It's there and available. And from what I understand, there's another funding opportunity that's opening up today with the $20,000 or maximum $20,000. And from what I heard the other day from economic development, they're hoping that when a business applies for that once they've been approved, the money will be in the bank within 8 days. So please have a look at those and see where your business may be able to apply for those grants. So we had to issue the stay-at-home order this week to, again, try to limit people's mobility, because we know people do continue to travel, even though we are asking them, only essential. It really has, people are still moving about, and you can look at the parking lots and the plazas and the big box stores to see that's continuing to happen. So we are trying to limit the outings to essential trips, such as grocery stores, going to a doctor's appointment, and all businesses must ensure that any employee who can work from home does work from home at this time. This is in response to the alarming and exceptional circumstances and the deadly outbreak of the trend of the transmission that's going on. And Carmen spoke to that. And Carmen, your passion, you need to be at the podium with the Premier talking about what it looks like, in our rural communities as well, because I just think people just don't get it. And, when we're hearing here today that we're taking patients from other ICUs across the province, if there was a deadly car crash here someday and, somebody we knew needed an ICU space and they couldn't come to our own hospital and had to be shipped off somewhere else. That is life or death. And I think those kind of things really hit home with people that this is happening, and it's we need to be doing more. So some of the additional public health measures during the state of emergency, I said the stay at home order, of course. And you know what, I think a lot of people locally are really taking that seriously. We've had some people calling the office and emailing, saying, I have to drive someone to the airport in Toronto. Am I going to get pulled over, and do I need a letter for that? Somebody else was picking up somebody in Toronto who is staying by themselves and needed to be with somebody, and can I get a letter from you for that? So I think there's a lot of people who really do take it serious, and I hope more people will. So again, this is requires everyone to stay at home with exceptions for the essentials, going to the grocery store, pharmacy, accessing healthcare services, exercise, and for essential work where your work cannot be done remotely. Outdoor gatherings have been limited to 5. And so this isn't just 5 within a house, it is 5 people, so it can be from different households. And we really had to look at this one because there's a lot of people, and not just seniors, who live alone. And to say that they can't go out for a walk with their neighbor would be heartbreaking. So we've really restricted that to 5. And again, if you're not from the same household and you're going out, to maintain a physical distancing during that time. Limiting non-essential construction. So this has been further restricted, including below the grade construction and exempting survey. So, anything that is related to, essential infrastructure, healthcare, long-term care, those kind of things will still continue, but trying to limit the people who are out and about on the roads. For retail, all non-essential retail stores, including hardware and those offering curbside pickup or delivery, must be open no earlier than 7 a.m. and close no later than 8 p.m. The restricted hours of operation do not apply to stores that primarily sell food, pharmacies, gas stations, convenience stores, and restaurants for takeout and delivery. So, there was conversation about really restricting those hours down, but then you have to look at, do you want all those people in a grocery store, during 9 to 6 or say. So I think this is also will help to spread that out a little bit in keeping people, less groupings in those areas. Masking, continue to wear your face mask indoors. Recommending the use of face coverings outdoors if you're within 2 meters of someone who is outside of your household. And expanding rapid testing for critical businesses, long-term care homes, and schools. So the government is going to provide up to 300,000 COVID-19 rapid tests per week to support key sectors such as manufacturing, warehousing, supply chain, and food processing, as well as additional tests for schools when they return and long-term care homes. So Mayor Clark asked me about this yesterday, and there's actually a meeting between economic development and health today on how manufacturers will get those rapid tests. So I know, Matthew, you might have that might have been your question to the mayor, but we will have more on that shortly, and I will definitely follow up with Alan at the chamber to get that information out when we have it. And the government is also expecting to receive 12 million the PanBio rapid testing devices from the federal government over the next several months. And so we'll continue to purchase those and get those out to the sectors that will need them. As part of the emergency order this week, we again saw the suspension. So this is suspends enforcement of evictions and pausing the residential evictions and ensuring people are not forced to leave their homes during the declaration of emergency and while the stay-at-home order is in effect. So we saw this early on in the first emergency order and provincial lockdown at that time. But we still remind tenants that if you can pay your rent, you must continue to do so at this time. And we're really encouraging landlords and tenants to work together, as they have been doing for the last several months to keep everyone safe. Under the order, additional enforcement powers. So this provides new authority for police and other provincial offense officers to disperse gatherings or organize public events that are not complying with gathering and event limits. So this is not just police, but First Nation constables, special constables, our bylaw officers can temporarily close premises where prohibited gatherings are occurring and require individuals to vacate. So, you know, I guess now compared to early on when this was happening, I think it was more of an education at that time. Officers and law enforcement were, you're not looking to lay tickets and charges at that time, but you're going to see this is definitely will be happening this time. People are educated now. They know when they're doing something is wrong, and they will be fined if that is the case. So that the ticket amount is $750, an obstruction of any person exercising power in accordance with an order, $1,000. So I know we'll be working closely with our local bylaw officers across the riding to ensure that they're supported as well at this time, because it does give them those additional powers to lay these tickets. And yesterday, the Minister of Labor launched a big box blitz. This is in the GTA at this time to ensure that large businesses are doing everything they can to keep workers and the public safe. And this blitz will soon be expanded province-wide. And this weekend, we'll be seeing an additional 50 inspectors, as well as local bylaw and police officers who will be visiting stores in the hot spots, such as Toronto, Peel, York, Hamilton. And this will be ensuring that stores are operating at 25% capacity, that workers and patrons are wearing masks, there's physical distancing and following the public health measures. So individuals, again, can be fined $750 for non-compliance with the Act. And corporations can be fined a maximum of $10 million. So this is, you know, to be taken seriously. And, you know, I look to what I see going around in our community, and I see that the public is following the measures as well as the businesses. So these efforts are building on the Stay Safe All Day campaign, which was announced earlier this week, which will focus on workplace inspections in the high transmission areas. And a little bit on the vaccine, you know, as we continue vaccinating our most vulnerable. And Carmen, it was great to hear locally what is happening, and that you know, by next week the long-term cares will be vaccinated. That's good news. You know, we're in phase 1 now, but you probably would have heard this week General Hillier talking about the moving into phase 2, which will be as early as March. So the overlapping of phase 1 into phase 2 to as soon as we have sufficient vaccines that are available from the federal government. So there are so many working pieces at this time, you know, what the feds are getting and then passing down to the provinces, but at least being in that position that as they come to us, we're able to get them out quickly to those people. So vaccination of residents, staff, essential caregivers at long-term care homes has begun in many parts of the province. And the goal is to have that first dose administered in all homes no later than the middle of February. And all staff and residents in long-term care in the 4 highest rates of transmission areas is expected to be completed by the end of next week, January 21st. So at the end of phase 2, we're hoping to have immunized up to 8.5 million people if the vaccines are available as we roll along. So that will include adults, beginning with those over the age of 80 and decreasing in 5-year increments over the course as the vaccine rolls out. Individuals who are living and working in high-risk congregate settings, so group homes, women's shelters, emergency care shelters, essential frontline workers, so first responders, teachers, those who are working in the food processing industry, individuals with high-risk chronic conditions and their caregivers. And you know, as I said, as soon as we receive them from the federal government, we're getting them into the arms of those vulnerable people and frontline workers who need them immediately. So you know, we're continuing to work with the federal government to ensure that we get those. I know Carmen answered Judith's question about how would the municipalities be involved in that. So I'm glad to hear that you guys were on the AMO call yesterday between the Premier and General Hillier, and I think Solgen and Health was on that call too. But vaccine sites will include municipally run vaccination sites, and Carmen touched on how that would look with our local health team. Mobile vaccination sites. We have our pharmacies on board and clinics and primary care settings. So, at this point, they've administered over 144,000 doses of the vaccine across the province. That's not a huge number, but we're getting out there what is coming to us. So we'll continue to do that as quickly as possible and ensure that that vaccine is rolled out as quickly as possible. So with that, I will take any questions.
Well, it looks like you're getting off easy, Jill, and I know you've got to run, and we've got to move on to Mayor Clark because he has to go. The confidence.
If you have any updates, I'll get to the chamber to get to everybody. There's lots coming every day, but stay healthy.
Thank you. Have a great day, and we'll see you again when Alan schedules another meeting for us.
Sounds good. Here.
Mayor Clark, I know you've got to leave at 9:45. What can you provide us with the city update?
Glad to. Yeah, not till 9:55 actually, so I'll hang around and bore you a little longer. Anyway, I'll try to be quick and succinct. I know also on this call is Jennifer Ruff, who has had to endure me for almost 300 emergency management meetings since this thing broke, and she's the head of our business development and communications department, and we'll bring up a brief update on what the ERTF is doing, the Economic Recovery Task Force, of which the Chamber is a significant part. Anyway, 2021, happy 2021, everyone. It started off very precariously with with the case numbers going where it has, and where they have, and what happened in Washington. Somebody sent me a message about a week or so ago. It said, I did the 7-day trial for 2021 and said, no thanks. But in all seriousness, 2021 will be a much better time. We just need to get through, as Carmen has described, the next couple of months are absolutely critical. And Nathan and Alan and Bill, thanks for hosting this and allowing that message to permeate into the community, because that's exactly what has to happen. And the reality is, as Nathan said, at one time we had very good case numbers, and still relative to other urban centers, we still do. So citizens, for the most part, have taken this fairly seriously, but we sure as heck cannot let our guard down now. There is light at the end of the tunnel. The vaccine is actually in our community now at LTCs, as was well articulated, and into our seniors homes. And that is where, of course, we have some of our most vulnerable citizens, and unfortunately, a significant percentage of the deaths, especially over the last couple of weeks. And it's absolutely critical that people take care of themselves, but that this thing does not spread. The projections are right now that the ICU numbers, as Carmen said, are up around 400 in the province, and the number of people on ventilators is getting almost out of control at the moment, and that's projected to get a lot worse over the next couple of weeks. And what's going to happen, in the province actually put information out today telling hospitals how to triage and make decisions on who is going to live and who is not going to live. And we need to do everything we can do to avoid that particular situation. Anyway, on a slightly lighter note, despite COVID in 2020, the city's been very busy with regular business, and I won't get into all that right now, but the building activity has been significant. There seems to be a significant in-migration, and not just from people who are nearing retirement and are retired, which was traditionally the case, but we have a lot of interest from millennials now, who are now making a decision on where to live more based on the quality of life than actually on the jobs available. The job is still important, but it's just not the number one criteria. And with that in mind, and trying to create jobs, as people on this call know, we closed the deal with Hydro One, and just as of last week, so they've started their significant investment in West Orillia. which will bring great paying jobs for decades to come. And we've also signed off on selling them another 21 acres for a provincial warehouse and a regional operations center, which will also add to our job inventory. And also, as JR Jennifer Ruff can tell you as well, the interest that we've had in the employment land that we've now got ready for sale, and actually are beginning to sell. The interest has just been off the charts, and we've sold many lots out there, or negotiating to sell many lots out there in the last few weeks. Anyway, the city hall is now closed down to the public. It essential services only, but not open to the public. They'll be online or by appointment only. All the staff that we could have been and can work from home are now doing so. I'll pause right there and maybe Jennifer, if you'd be so kind, just to give a quick update on ERTF, and then I'll just finish off with a couple other notes.
Sure. Thank you, Mayor Clark. So for the ERTF, and I do see Alan and Wendy on this call as well, who are very active members on the ERTF. So this will just be a high level overview, but I know staff in the Business Development Division and members of the ERTF continue to make a main priority being the conduit of information to our local businesses. I know anytime the province provides a release or guidance document, updates to regulations, we're being very proactive in making sure we get that into your hands so you're not having to search for information. I know Jill did mention that we reached out in regards to rapid testing, because there is certainly some interest there. So we look forward to that information. And as soon as we hear anything, we'll make sure that the ERTF is able to provide that information out through our various channels. It was released earlier, but just as a reminder that the city is part of administering the financial support program ranging from $2,500 to $20,000 for small to medium-sized tourism enterprises in Orillia and surrounding regions. So applications, just as a reminder, are due January 31st for that, but you are able to apply for projects that you've already, whether it's plexiglass, whether it's an extended patio, what that may be. Applications can be made at RTO 7, and the city of Orillia is part of administering that grant. So that's really exciting. One of the things that I know the ERTF is talking about, and wearing my double hat on the Emergency Management Committee, is the reinvigoration of the Stay Safe Shop Local campaign. And I know looking to find a way that allows us to do that while also being mindful of the stay-at-home message. So there will be some more brainstorming, I think, on that and potential look at how we can support that type of campaign while also keeping the public health measures in mind. One of the things as well that looking kind of forward to it in the future is the TEDx Orillia. You'll recall we had a really successful TEDx, I believe it was last year, looking at how we can perhaps do a live streaming version of that to allow for a future focus forum as part of the phase 2 COVID recovery plan. So that'll be the Business Development Division, but also in conjunction with the ERTF. And also just a big thank you to Alan, and I see Erica here as well for the Light Up Orillia. I think that was a really great campaign. We definitely got a lot of interest on our Tripvia app tour, which was great to draw interest to that, but also a really great way for that mental health initiatives that we talked about as being so important. The one thing too that I'll just mention, because I know the ERTF has brainstormed, but it has changed a few times, is how we can contribute to that mental health initiatives. And we had some great ideas as a city. This is a little beyond the ERTF, to do some really big, wonderful things. But with the lockdown in place, we are readjusting our efforts and are looking in at a February Winter Active campaign, which we will loop in some ERTF initiatives into what will be like a COVID safe calendar of things to do throughout the month of February. So stay tuned for that, and happy to answer any questions.
Thanks, JR. And just to finish off, some of our discussions right now is, what can we do to adhere to the provincial regulations and yet provide safe and healthy activities, as JR mentioned. One of the activities that is not safe yet is to be out on the ice. We had somebody go through yesterday morning, I believe it was, and as a result, we had 4 fire departments involved in a rescue, and many of them went through the ice. So we're putting our first responders, not just the people putting themselves in harm's way, but also our first responders. So anything you can do to get the message out to stay the heck off the ice, it would be very appreciated. We're also deciding what to do. We've had to shut a lot of things down in the city, as you well know, the rec center, Rotary Place. And, you know, do we, now that with the measures being extended, do we keep the ice in the arenas, or would we pull the plug on the season? And so these are, it's a balancing act in our decision making that we're working on. Outdoor rinks, we've actually decided to not go ahead with those. They were probably going to open up in the next week or so because of the pinch points that are naturally on outdoor rinks, and plus they had to be monitored every hour they were open. And with those two things in mind, and of course they're natural, you know, you're going to have people gathering, and of course you're not supposed to gather, you're supposed to stay home. We are going to keep the toboggan hills open through the weekend and monitor the behavior on the toboggan hills. But I know Cooch Golf Course, for example, often will have 100, 150 people there. So if those, you know, they'll be monitored steadfastly this weekend, and hopefully the behavior is such that everybody is staying distance, and we will be able to keep them open. If not, we'll have to shut those kinds of things down. We're getting a lot of concerns at City Hall about, again, visitors to our park. Who would have thought that we would have had a replication of what happened in the summer when we were overwhelmed with numbers in the park? It's a little bit different this time. People seem to be showing up and then going out on the Cooch for different activities. But we are going to monitor that this weekend as well, and discuss that on Monday. And I mean, it's such an interesting balancing act between allowing certain activities to go ahead safely and not having people gather. So that's one of the fine lines that we're walking. And I know JR and ERTF, with, as I say, with Wendy and the chamber as a part of, are doing great work. And even with that, we are beginning to see businesses close down. We had 3 businesses that have been around for quite some time on the main street shut down in the last week or so. We're hoping to of course avoid any much more of that kind of activity going on, because that's the economic, well, first of all, they're individually they're not happy stories necessarily, and certainly making it even harder to recover the economy when we come out of this. Very lastly, as Jill mentioned, education for our by law enforcement, for our OPP, which is our policing agency. Education is still important, but it'll be a lot less education this time and more enforcement. And our bylaw and OPP met in the last few days to decide who is responsible for masks, for gathering, for businesses that are not essential, that are operating incorrectly, all these kinds of things. Anyway, so that's all been straightened out, who's going to be doing what. And on that note, I wish it was on a happier note, but I mean, this is the tone of the time we're in right now. And but anyway, I do want to say, Erica, thanks for coordinating this, and because I know the same thing at City Hall. Comments will come to the mayor, but the mayor doesn't get anything done without great support. So anyway, thanks all, and I'm glad to take any questions.
Steve, you touched on it a little bit there with what happened last summer with the parks. Has there been any discussion planning with our neighboring municipalities in terms of what we're going to do with parking, boat launch ramps as we roll into spring? We can almost write winter off, I guess, with what's going on, but to roll into spring with a stronger plan than we had last year?
Yeah, well, I would say the plan was very strong. It just, if we had more time, it would have been done differently. It had the desired effect. The undesired effect it had was to not have our neighbors involved, and that was most unfortunate. We had 6 days to turn the plan around, and that did not allow us. Normally, these things would be planned over a couple of months with stakeholder consultation, et cetera. Anyway, that is definitely taking place this time. So it's a great question, Nathan. So the answer is yes. We will, whatever we have in place for this summer, because we assume that COVID is still going to be an issue, and we want to make sure that we have a safe environment. But this time, I believe almost most assuredly it will involve our surrounding township neighbors, who are a vital part of the city.
I can see Judith nodding. I know she's happy to hear that. And I'm looking
everybody but Judith.
I'm looking at Joe and he's laughing. So thank you. Thank you, Mayor Clark. Appreciate your time. And we've got you out just before you have to leave.
Indeed. Thanks all.
Thanks. And we'll move on to the ever patient federal member of parliament, Mr. Bruce Stanton. We can thank you for no sun so far in January. I'm going to keep that joke going
Precisely.
until it gets really
Yes.
tired.
Gray days are all ours. That's correct. Yes. Look, thanks very much, and great to be on the call this morning. My notes indicate that our first one of these calls was actually on the 27th of March of last year, only 2 weeks after the pandemic, the global pandemic, was declared. So that's a real testament to the chamber and what you continue to do for our communities. So certainly appreciate that. I'll keep this fairly brief. There's many of the programs that, even going back to our last call in October, we've really not too many changes in that respect as far as business support goes. I do want to just a brief mention just on the vaccine. There is a really good resource for that if you want to keep tabs on where that's sitting sort of nationally. I've just sent that a link on the chat column, and it's the COVID-19 tracker.ca. There's a section there that talks about entirely, literally on a day-by-day basis as to how the vaccine rollout is going. About 750,000 doses already procured and delivered, and that's going to continue to grow as we get into 2021. The target's for around 3 million by the end of March, and that, as you may see, look, there's an abundance of information on how this, just by watching the daily news. Our health officials have been really good at updating and getting good information out there, but there's lots there if you need to dig into it. Just a brief mention on some of the programs that I mentioned, the ones that are typically out there to support both workers as well as businesses. For the workers, the Canada Recovery Benefit as well as EI is responding to people who are off work because of COVID. And of course, with this latest round of restrictions, that may create more layoffs, temporary layoff situations. So we're encouraging people to look at either of those two options to get some income support until their jobs are back open and available. One note on that, the difference with the new programs, their taxes are being withheld on these new benefits, roughly around 10%. So the $500 a week benefit that was available in CERB with no tax withheld, under the new program, there's 10% that's held back. On the wage subsidy, both the wage subsidy and the rent subsidy program are each of them run off a similar sort of 4-week blocks of time that you have to apply each 4 weeks. The wage subsidy and the rent subsidy program are now continuing through until June of 2021. Speaking on the wage subsidy itself, at the moment, the maximum wage subsidy you can get is 75%. That continues through to only till March 13th. Then presumably it'll drop back down to 65%. Both of these programs are designed around the subsidy percentage you get, either for rent or for wages. It relates to what your drop in income has been compared to the reference period. So you basically go online, there's a calculator there, and depending on what your revenue drop is, the subsidy then is based on that. So those programs are still running. We've heard anecdotally from a lot of businesses in our area, particularly tourism businesses that have been, literally had to close entirely, that the wage subsidy program is helping and really getting a lot of cash flow out to people to help carry them, businesses to carry them over this period of time. So that's going well. On the CEBA, that's the now $60,000 loan that you can get through your commercial bank, but it's backed by CMHC and, I should say that through the Business Finance Canada essentially backs the CEBA loans. And that is now up to $60,000 with $20,000 forgivable if the loan is repaid by December 2022. And so that's all in place, and not too much else in the way of changes in there, though, although initially with that program, you had to have a business account at a commercial bank. And you had to have that account in existence prior to March 15th of 2020. They now open that up so that you can, if you don't have a business account, you can apply, go into your bank, get one, set it up, and once you have that business account, you are eligible to get a CEBA loan. Should point out those are just for non-deferrable expenses, things like insurance, property taxes, utilities, and rent. And a final mention on the programs, the Regional Recovery and Relief Fund, that's managed and delivered by our own Orillia CDC. There's still some funds available in that, the RRF loan fund. And again, for businesses, they can apply. Talk to Wendy and her capable team at Orillia CDC. And that's about it. I'm happy to take any questions, but again, just add really the privilege to be able to participate in these calls and stay up to date on these issues.
My first look is always to Judith to see if there's any questions. No. Bruce, thank you. You seem to get off easy today. It's been quiet on the federal front. Happy with the support that's continued for businesses across the country. It's had a positive effect. I know in the industries that we've talked to from the chamber, it's made quite a difference and kept us going. If there's no questions from the floor, we'll speed this up and we'll move on. I'm just looking at my notes from Alan here to see who we've got next. And we're going to move on to Ramera Deputy Mayor Joe Goff.
Good morning, everyone. I guess we're going through the same sort of situation that we did with the first official lockdown. I think we're just more prepared this time. Our offices have closed, and what we've done this time is actually divided up into teams for anybody that still needed to work in the office. That way we won't have everybody out if COVID happens to show its ugly face. Earlier in just before Christmas, we did have a staff member that did contract COVID. And the person's doing well, back to work. We did have the health unit come in and go through our protocols and said we were right on track, didn't have to change anything. So that was good news that we're on the right page. One of the things that we're having some concerns with now, or residents are having concerns with, is the influx of people that are coming up ice fishing from out of area. So we'll be waiting to see what Mayor Clark in Orillia does with his parking and how they're doing that, because obviously what they do is going to affect how we handle things. Because if they put a limit on people or start charging for parking, we're going to get the overflow. And that's relatively about it.
Joe, thank you. Yeah, we're all just playing the wait and see game at the moment. Nice to know that Orillia seems to be engaged in the conversation, not that they weren't before, I'll choose my words carefully, in what we're going to do with the parking with the municipalities and with out-of-town residents coming to enjoy what we've got here and to get outside. And if Mother Nature continues on this, we'll solve the ice fishing problem through I guess it'll just take care of itself as they all fall through, unfortunately, if it doesn't get any colder sooner. Natural selection will take care of that. We'll move on to Judith Cox and the update from Severn.
Pretty much the same. Our office is now closed. We are doing some building inspections with construction that had already started prior to the thing. The other concern we're having is with outdoor rinks. The weather has not been good for us, which may be a good thing. So it's just a decision on, do we do the outdoor rinks? And now I've heard that Orillia is closed theirs, Clearview is closed theirs. There's a lot of them. So I doubt very much that it will open. Ice fishing, we don't have big issues with it, but I'm just amazed that anybody who'd be out on the ice and on our McLean Lake, I mean, it's just not safe at all, but that's up to them. And the other one is what I slightly mentioned to Carmen was our township has decided that we came up with the idea to do the Snowman Challenge for January. And in February, the challenge will be about heart. So we'll have a upcoming for all residents to participate in different random acts of kindness, outdoor activities, and then we're going to have a theme for March, because we're just trying to get people involved and keep people interested and get them outside safely. So everything we're doing, you don't have to have a group. It can just be done in your own yard, or you can go for a walk. So it's just a community spirit. And other than that, that's pretty much where we are. And I look forward to our meetings with Orillia about parking. Okay, thank you.
Thank you, Judith. We'll move on to our next, or probably our second largest industry in the Orillian area, post-secondary education. Between Frank and Stephanie, we've had to learn how to change our business, or you've had to learn how to change your business model and what you do. And what can you update us on today? We'll start with Lakehead and Frank Cappadocia.
Yeah, thank you so much, Nathan. You know, you always start with me. I thought maybe, why don't we give Steph a first run at things, right? Because then I can say ditto after her part. Steph, what do you think? Let you take the lead today.
Well, you put me on the spot there, Frank, so I'm not quite sure I can say no in front of all these people. Nicely done, my friend. I owe you one. Please note that in the minutes.
Anytime for you, Steph, anytime.
There you go. I know. Always thinking of me. Good to address you this morning, group. I will make this quick. You know, we're all, we've had to shift and change in terms of our shutdown orders. And what does that mean in terms of from where I sit? Right now, it's not all hands on deck. It's only essential hands on deck. So what does that mean for post-secondary education? At the Orillia campus, you're only going to find faculty that need access to Wi-Fi, and that's very few. We do have some faculty that are actually quite remote in terms of where they live, so they actually have to come on campus if they're delivering asynchronously, which means that they're with their students. If they have a 3-hour block, they're actually with their students in that 3-hour block, so they don't have the bandwidth to support that. So they're few and far between, but we do have a few on campus. Our cleaners, our facilities, and our security. We did have some additional plans to have some additional people on campus, but again, that we had to shift and change to adjust. 90% of programs are remote. We do have our pre-service fire program, again, that requires the hands-on. There is a special list group. I'm not quite sure if you're aware, but there's the nursing programs are on that list, addiction programs are on that list, social work and psych programs are on that list. And what that list means is that if you need practical learning on campus, you don't actually have to abide by the 10 people. At Georgian, the direction from senior leaders has been that it's actually 10 students and faculty. So there isn't sort of any clarity in the documentation as it relates to post-secondary. So that's how we're planning. We will continue to do that. So we have fire that's got applied hands-on learning. We also have developmental service worker. They have some pharmacology courses that really requires them to be hands-on sort of together. And again, we continue with our protocols. We've had great success with our protocols, and so off we go. Lastly, just in terms of our on the international front, now all post-secondary institutions that are bringing in international students are required and responsible and accountable for them from the moment they land. We have supported over the last 3 weeks about 122 students who were in quarantine. We are responsible for everything as it relates to their quarantine, making sure they secure housing, making sure they have access to food, making sure they have access to any sort of resources they might need. And we're still waiting for 70 students to arrive. And these are new students coming into our winter start semester, but they're also returning students. So it's a combination of the two. Regardless of how they're coming back to the country, regardless of if they're returning or new students, they have to follow the same protocol. So that's about it from Georgian. We are, we're well positioned to take on the winter semester. We did a lot of learning through the fall semester, which then allows you to tweak and change to bring on the winter. And so here we go. That's all from Georgian. Mr. Frank, over to you.
Thank you, Steph, and ditto. Everything. There you go. So on our end, just echoing everything Steph's basically covered, and exactly the same. Very, very limited number of folks. So all I'll add is we did throughout all of this chaos come up with an outlook document for the Orillia campus that kind of outlines where we hope the next 4 years will take us. We literally took one of the 5 years off of our 5-year plan just because of what happened with COVID, and I'll make sure I share that with the full chamber, and we'll walk you through that at some point. That's it for me.
Thank you to Stephanie and Frank for your update. And we have an update from a new member I'd like to welcome Alicia Wasigajich. I'm going to butcher that, and I
I'm just gonna
apologize.
let you try that.
I had to try. I had to try. Thank you for joining us today. I hope it's been informative so far. And what do you have from an update from Rameth First Nation?
Thank you. So Chief Ted Williams sends his regrets. Just like other leaders, we've got meetings booked back to back to back and overlapping during this time. Short update, just that Rameth First Nation, we have staff continuing to work from home. Essentially, we're maintaining the same protocols that we've kept up since the first shutdown. So all of our community programming is happening online and continuing to reiterate the same messaging of staying at home, wearing a mask, using your proper PPE protocols if you do have to work on site. And just again, like other municipalities are probably experiencing, lots of meetings with the small businesses and organizations and departments, making sure that everyone's being safe.
Alicia, thank you, and thanks for joining us, and look forward to having you continue as a member of these meetings going forward, or Ted when he's available. Quick update from Executive Director Alan LaFontaine.
Thank you, Nathan. Just want to give an update on what's upcoming. Of course, we continue to give information to the Chamber on all things business. And we've got upcoming sessions such as our Business our Business Achievement Awards, which are going to be March 4th. They are going to be virtual, and we've got more applications for Business Adversity, our new category award this year, and I certainly feel the whole community deserves it, both for the businesses keeping their customers safe and for all local residents who have been shopping local. Do whatever you can if you're watching the meeting to pass that message along. Certainly if you're a business and you've seen a decrease in business, reach out to your customer base, tell them you're hurting, and arrange delivery or curbside pickup for them so that we can keep this together. I know the Rotary Club of Orillia started Takeout Tuesday. So it's sort of a two-pronged message here. Is if you check out their Facebook page, you can see what the offerings are. It's based on getting people to get out and support our local restaurants. Remember those favorite chefs that you have. We want them here after the pandemic. So having a takeout day. If you're a restaurant and you haven't been involved, there is a link on there for someone that you can contact to get in on that program. And just in general, once a week as a habit, if everybody does a little takeout, picks up the spirit. If you need any information or an update or really need help as a chamber member, please reach out at info@orillia.com. And remember, everybody, stay safe, test negative, and stay positive.
Thank you, Alan. Bill, any updates as our new president? Any comforting words?
No, I just great to hear all the information that everyone has to share. This is my first time attending one of these meetings. So Nathan, I'm appreciative that you are going to continue to host. I think you've got it well in hand. You've certainly had a lot of practice over the last year. Yeah, and just going forward, anything the chamber can do to help, please let us know.
Thank you, Bill. Yeah, I don't mind taking this off your plate. And to everyone that came this morning and gave up their time, we really appreciate it and look forward to talking again in the future here when Alan schedules another meeting. And hopefully we have a more positive outlook at that point with the rollout and new restrictions in place and somewhat diminishing numbers of positive cases in Ontario. Everyone have a safe and happy and healthy weekend.
Thank you. You too. Take care.
Cheers.
Thanks,
Bye, everybody. Take care.
Thank you, everyone.